Good morning and welcome to Medicare Made Simple with Medicare Myriam and her co-host Traci from Smart Caregiving. Medicare Made Simple is brought to you by United Insurance Experts. Call today 561-464-CARE. That's 561-464-CARE. Now here are Medicare Myriam and Traci with Medicare Made Simple.
Good morning, everyone. I'm your host, Miriam Leyva with United Insurance Experts. United Insurance Expert is not affiliated or endorsed by the government or the federal Medicare program. We don't offer every plan available in your area. Currently in Palm Beach County, we represent 10 organizations which offer 49 products in the area. Please contact Medicare at 1-800-MEDICARE or online at medicare.gov to get information on all of your options. The purpose of this show is to connect you with valuable resources and to educate you on Medicare. With me is my co-host Traci Lamb with Caregiving Worldwide. Welcome, Traci.
Good afternoon, Miriam. Welcome everyone to Saturday.
Yes.
What a crazy, crazy week I've had, but I am glad to be here. How are you, my friend?
I am doing great. Being a mom of two young girls, I'm everywhere, I'm like Dr. Seuss, here, there, I don't even know anymore. It's just everywhere. My 4-year-old just turned 5 last Friday, and we've been celebrating her birthday. It seems like every day. So it's like a constant birthday with her. But it's always fun. But all good. So, Traci?
I agree. Raising kids and, life in general can just be completely crazy.
Yes.
But, we just kind of do one thing at a time and keep taking it one day at a time, without a doubt.
That's right. One day at a time. That is definitely what I try to do every day. Just get through the day, Miriam. Just get through the day.
That's exactly right. Some days it's definitely like that.
And actually, I think, one of the things that I'm going to be going over today is those common errors that many Medicare recipients make when they're first eligible for Medicare. So yeah. I'm going to be going over that. And how about you?
I think I'm actually going to be talking about, there's a program on my Safe and Sound website called Think Different Dementia. A woman by the name of Lizette Clote runs it, and it's a scientifically based background way, based evidence way to deal with dementia. Lizette has dealt with dementia for a long time. Her mom had dementia, and so she does free webinars, and so you can kind of learn more about it. And so I think I'm going to be talking about what she has with that particular program, because it's a really, really great program.
Yes. I look forward to hearing more about that. And I was hoping that, I know that I'm going to be talking about common errors and mistakes that we make, when we're first eligible for Medicare. Is there anything that, you feel that is common mistakes that
Yes.
caregivers make?
Yeah, absolutely. I think one of the things that I run across all the time, my own parents even thought this, people think Medicare and Medicaid is going to pay for everything.
Yeah.
When they get to a certain age and when things start happening, and then they get shocked when they find out that's not the case.
Yeah, I see that a lot too.
Yeah, and so I get that a lot, and people are like, well, what do you mean if I have to go into a facility that they're only going to pay for 100 days? That's a really common one, that I get a lot. And, then they get sticker shock when they look at the cost of facilities, because it can be very, very expensive.
Yes.
And when they haven't pre-planned for that, it can get really, really bad. So I think that's a huge
that is a huge one.
problem.
I've actually seen a couple this week alone where I've talked to a couple family members, and they're like, mom or dad needs to go into a facility like right now. They're like in the hospital and they've been diagnosed with this and that, and they need to go in. How do I get them in there? And, the first thing that I ask is like, are they on Medicaid? And they're like, no. What do we do? It's like, you see, a lot of people don't realize that it's a process. It's an application.
Yes.
There's also a waiting list
Yes.
to be, to qualify for this. So it is something to start looking into it prior, right? Don't wait till
for
the last
sure.
minute when we're in crisis and be like, okay, what do I do now? Mom and dad, were just diagnosed with dementia and they're at the ER right now, or they're at the hospital. And where do I put them? It just doesn't work like that. It's just way too hard at that, rushing at that last minute.
That's one of the reasons why I try and tell people, honestly, to me, aging in place is kind of like wanting to retire. Honestly, you need to prepare,
Yes.
and you don't wait until you're 75 years old and then go, oh, maybe I should do something about my retirement.
Yeah.
No, you plan. Well, it's the same thing. It's the same process. You think before you do anything, and then you go ahead and you start planning to age in place at home.
Yeah. Yes, that same it applies to Medicare. When you know that you're going to be turning 65, if you're 64, 64 and a half, that's the time to start learning about Medicare. Get your education. There's a lot of education online, or, contact your agent, or you can contact United Insurance Experts. We're more than happy to help you. Again, This is free. We're not charging you to educate you. You don't have to sign up with us. We don't have to do, you just call and we're here to answer any questions. So to talk about one of those errors is failing to enroll in Medicare at the right time. That's a big one that I've seen because you're only eligible to enroll in Medicare during specific periods. The initial enrollment period begins 3 months prior to your 65th birthday and ends 3 months after your 65th birthday. So you have a 7-month window. You have those 3 months prior to your 65th birthday, your 65th birthday, and then 3 months after your 65th birthday month. So that's that 7 months window. And you either enroll then, or you enroll during the general enrollment period that runs from January 1st through March 31st. This is called the general enrollment period. Now, if you missed your enrollment period and you have to wait till the general enrollment period, keep in mind that you might be subject to penalties. Medicare does penalize you when you don't have credible coverage. So again, this is so important for you to understand that you're either going to enroll in Medicare when you're first eligible. If you decide to delay Medicare, make sure you have that credible coverage, right? Or enroll during the general enrollment period. So that's one of the errors that I've seen with Medicare. Another one that I've seen is not fully comparing original Medicare with Medicare Advantage plans. You see, when you're considering Medicare options, remember you have two, main choices, right? You stay with original Medicare, or you go to the Medicare Advantage side. The Medicare Advantage side is also called Part C of Medicare. So original Medicare is traditional, right? It's your Part A and Part B. Part A is what you've worked for. If you've worked in this country and you have all your credits, your Part A will be free of charge because you already paid into it. Part B is the medical part of the plan, like your doctor's visits are covered through Part B. Another Part B is like outpatient services. And there's other things that are covered through Part B, but this is the part that you enroll in. So that's traditional Medicare. It's basically that red, white, and blue card, and that's Part A and Part B. That's it. So from there, you can purchase a supplement to cover the gaps of original Medicare and then get on a Part D plan as a standalone, so you have prescription drug coverage. On the Advantage side, that is also called Part C, is a replacement. It's an alternative, right? Because you can't have both at the same time. You could either be on original Medicare or go on the Medicare Advantage side. And that's why it's so important that when you become eligible for Medicare, that you understand these two options. Are you someone that wants to stay on original Medicare because you want to go everywhere, anywhere in the country, and you want to have that freedom and you don't want to follow networks? Then that would be probably a better choice for you. Or the Medicare Advantage side, understand because, as long as you understand that it follows networks most of the time. So just understanding those two is very important so you could avoid misunderstandings at a later point.
Yeah, and I completely agree with you. The reality is that people need to understand, number one, when they need to enroll. They also do need to understand that Medicaid processing is a process. It's one of those things that it takes longer than a month to get enrolled in it. And so you absolutely do need to be able to get enrolled so that when you need it, you've got it.
Yes.
Because all of a sudden you may turn around and find yourself in a place where you need it, and now you've got to wait months before it even gets approved. And that can be a real problem. I know that's what happened to my dad.
Yeah.
He did not have Medicaid. Luckily, he had the VA. And so we were able to, when we sent him over to the nursing home, we were able to, the facility started the Medicaid process. And because facilities, when they apply, they can actually push them through quicker. And so they were able to push it through a little bit quicker. But still, we had a gap in between when his Medicare ended and when his Medicaid picked up. And then you get a bill for $4,000, $5,000, $6,000, and they expect you to pay that.
Yeah.
And so people don't understand that. People think that, the Medicare will cover me until my Medicaid kicks in, and or my VA will cover me until my Medicaid kicks in. And unfortunately, that's just not the way that it works. And all of a sudden, you're going to be stuck with a bill. And
yeah, I know.
It's going to be definitely a bill you're not going to be expecting.
Yeah, or not being able to see, go into that facility or get that, how about that medical attention that you need? Because I've seen that happen where, I deal sometimes with the children and they have mom or dad. They need to go into a special, a skilled nursing facility, and they want their parents to go in there, and they just don't qualify. They're not, they're on that waiting list, right? And what do you do with mom and dad then? Or what do you do with your loved one, right? While we wait, So, yes.
Well, and that's one of the reasons why I wasn't going to talk about them today, but I'll just bring them up because they goes with the conversation. That's one reason why a company called Care Patrol is great. Care Patrol is a company, they have franchises all across the country. They will meet with the family for free. They will assess your financial situation. They'll see what facilities are close by, the facilities that would be affordable for you. And that way, when and if the time comes, you know where to go and what you can afford and what would be the best facility for you. And there's no charge to the family for that.
Oh, wow. That's a terrific resource, Tracy. You said, what's the name? Care Patrol?
The name of the company is Care Patrol. And you can look up Care Patrol anywhere near you. They have over 190 franchises across the country. Fantastic organization. Highly, highly recommend them. Like I say, there is absolutely no cost to the family. They will sit down with you, do a financial assessment, see exactly where you're at, make sure that you've applied for Medicaid, anything else, give you the best 3 facilities that are in the best locations that are close by to you and the family that are going to want to visit the person. And then, because there's good facilities and bad facilities, we'll just be honest.
Yeah.
And they will walk you through the facilities and make sure that you pick out the one that you like best. And that way you know exactly where the person's going to go when and if the time comes. And it's a fantastic resource.
Wow, that's terrific, Tracy. Thank you so much for sharing that. And they could also get that information from your site. Is that correct?
Yes.
So do you mind telling
me?
Yeah.
Sure, yeah. So the website, they can go to safeandsound.media. Again, it's safeandsound.media. And they can always sign up for our newsletter as well. We have a free newsletter we're about to start sending out that's going to always be telling people about new resources, new products that are available, our new TV shows. So if they want to sign up for our newsletter, please feel free to do so. It's completely free. And that way we can keep you informed of all the new items that are going on with our entire company.
Terrific. Thank you, Tracy. And if you guys missed that, you're welcome to call United Insurance Experts at 561-464-2273. We will be more than happy to connect you with Tracy to get more information. Okay, so another common mistake that I've seen is understanding your options if you work past age 65.
Yep.
Now, I actually see that almost every week. Even though you can sign up for Medicare at age 65, some people who plan to keep working and receive health insurance through their job decide to wait until later, right? So you can delay that Part B as long as you have credible employer coverage. So you can delay that Part B and just stay, with Part A, which I do recommend to get your Part A if it's beneficial for most people because it's free. But that Part B can be delayed. Now, if you decide to do this, just understand that, if you do have Part B, how it would work with your employer plan, right? Who comes first? Does your, employer have over 20 employees? Because these are important things to understand, right? Don't just delay Part B because you have coverage right now. Understand how Medicare, how does it compare to your employer plan? Because many people don't realize that Medicare does penalize you if you don't have credible coverage. And COBRA is not credible coverage in the eyes of Medicare. So be careful for those that delay Medicare because they're in an employer plan and then get on, COBRA not knowing that is not credible coverage. So you do have a period of time that they do waive that penalty, but it's important that if you're in this situation to contact Social Security, make sure you are in an enrollment period, or you're welcome to call United Insurance Experts to get more information about this. Okay, so again, it's very important that you understand when you do delay that Part B, that you understand your options and that you do have credible coverage if you're delaying Part B. Just don't say, okay, you know what, I have, employer coverage, I'm fine, I'm not going to do anything. No, get your education. Make sure that that employer plan is the right way to go. Because one thing that I've seen, Tracy, a lot is people saying, you know what, I just don't have the time. They're busy working. Don't do that. Get the education. No. It's great that you have coverage to the employer. And, for most people, that works out to be the best. But make sure that it is the best, right? Take that time to understand Medicare. The moment you turn 65 or you're eligible for Medicare, those 3 months prior, talk to an agent, get familiarized. You can Google information or go to Medicare.gov. Start getting this knowledge. Make sure that you're in the right plan, even if your employer is offering it. So that is my advice, to understand Medicare the moment you turn 65, even though you have credible coverage. Okay?
Absolutely. Absolutely.
Selecting a Medicare Advantage plan, this is another big one. When people go and select a Medicare Advantage plan, which is also called Part C of Medicare, and their doctors are not in the network. Mm-hmm. If you decide, right, to choose a Medicare Advantage plan, understand, okay, are my doctors included here? Are they in network? Are they out of network? My local hospital, I've seen, the hospital across the street doesn't have the person's insurance coverage. They don't accept it. So you don't want that. You want to understand that the facilities around you or the facilities that you're currently seeing are in network when choosing a Medicare Advantage plans, okay? Because these plans typically follow networks. Even if you go with a PPO, my suggestion is to stay in network, and there's many to choose from. One of my suggestions is to contact your independent agent, or you're welcome to contact us. We do represent multiple carriers, and we like to see, who are your networks, who are your doctors, to advise you which plan is the right one for you for this reason, because not all doctors, will be on the plan. It's just important to get this information before choosing an Advantage plan. One other thing I see a lot is waiting too long to purchase a Medicare supplement. Now, this is for the people that decide to stay on original Medicare, right? You have A and B. That's not 100% coverage. That's not full coverage. Most people purchase a Medicare supplement to cover the gaps of original Medicare, right? Because remember, Part A has that hospital deductible. Part B, you're responsible for that 20%, right? 20% coinsurance in Part B. So it's important that, people understand that if they don't have a supplement in place, that they'll be responsible for this gap. So if you wait too long, because you see these Medicare supplement plans, when you're first eligible, they can't say no to you. They have to take you. Okay, especially in the state of Florida, you have that, period of time when your initial enrollment period, and it's within 6 months. Okay, so within 6 months, they can't say no to you. You can take that supplement plan. But if you go past that 6 months, then what happens is these supplement plans can come back and say, wait a minute, let me ask you these medical questions. Let me make sure you qualify. And then that's a big one, because I've seen people say, you know what, I've been on original Medicare for years and I've been healthy. I never go to the doctors, but now I want to get that supplement, 5-6 years later. So here I am like, okay, I'm going to have to ask you questions. They're like, what questions? I'm like, medical questions. You have to qualify. And then people are shocked to find out that they have to qualify. They think that, I'm going to go get a supplement, whenever I'm, if something happens, I'm going to go get a supplement. Same thing like with life insurance. You can't get a diagnosis and then say, I'm going to go get life insurance now. It doesn't work that way. Same thing with supplements. They give you that 6 months period of turning 65, that guaranteed issue to get on a supplement plan. If not, you're subject to those medical questions. And another one that I wanted is failing to review your prescription prior to enrolling in Part D. I see this a lot as well. People are just like, you know what, I'm going to take this prescription drug. No, look at your medications. Make sure you review those medications and make sure that the Part D plan that you're choosing is the right one. Don't go, you know what, I'm going to go with the most expensive one. I've heard this a lot, Tracy, where they're like, I want the $100 one. I'm like, well, what are your medications? It doesn't work like that. Maybe the $20 one a month or the $30 one a month works best for you.
Yeah, and then there's a lot of really good prescription ways you can get prescriptions cheaper, like GoodRx and different things like that, where you don't have to necessarily have your insurance cover it. GoodRx, I know, I'm an epileptic, and so I have to get epilepsy medicine every month. And honestly, GoodRx, I can get a phenomenal deal through GoodRx at Publix. And I can get a 3-month supply. And so you have to just kind of be wise and shop around.
Yes.
Honestly, it makes more sense, especially when you're taking more medications. My mom takes a lot of medication. She probably takes 15 to 20 medications a day, which is crazy. Yeah. But, the older that you get, the more problems that you have, and so you get on more medications. Well, if you're going to end up having to take that many, it's wise to go ahead and find something that will absolutely be able to take care of that for you.
Yes, I recommend GoodRx as well. It's always good to compare. But one thing that I talk about when I recommend GoodRx is make sure that, because when you use GoodRx, it's not going through your insurance. Now,
no, it's not.
If you need, Part D works in stages. If you need that prescription drug to count towards your Part D, so you kind of meet that catastrophic stage, so then you don't pay anymore. So you got to understand, GoodRx is great, but make sure you understand how is it going to apply to the rest of your medications and your prescription drug plan. So it's very important to understand. If you're not taking many medications and you're like, you know what, I could use my GoodRx, it's fine, then that's different. But again, it's good to review your medication and understand how they work, right?
Yep, for sure.
But that was, did you want to mention one more thing? Because we actually have just a couple more minutes here.
Okay, I'll just take just a couple of minutes really quick. If you go to safeandsound.media, I will mention about Think Different Dementia. If you know of anybody who is having cognitive issues of any kind, Lizette Clote is amazing, and has an amazing program. Like I say, she has a free webinar that you can sign up for so you can learn more about it. It is scientific, evidence-based ways to deal with dementia or any kind of cognitive issues. And I would highly recommend it. Like I say, take the free webinar and then, talk to her because she's been dealing with it for many, many years. She's an occupational therapist and really knows what she's talking about. So I would definitely want to connect you with that resource as well. But I think all of this information has been really important today. People really need to understand about Medicare and Medicaid. They really need to understand what it pays for, what it doesn't pay for, so that you do not get into a crisis situation. And that is really what both Myriam and I are both trying to make sure of. We don't want anybody to get into a crisis situation.
For sure. So again, if you guys have any further questions or would like to learn more, please reach out 561-464-2273. Again, that phone number is 561-464-2273. And I wish you all an amazing weekend. Thank you again, and talk to you next weekend.
Thanks for listening to Medicare Made Simple with Medicare Myriam and Tracy right here on Legends 100.3. Medicare Made Simple is brought to you by United Insurance Experts. For more information, call 561-464-CARE. That's 561-464-CARE. Tune in next Saturday at 9 a.m. for more Medicare Made Simple with Myriam and Tracy.